So here we are with Dr. Joel Kahn, America's Healthy Heart Doctor, as per Reader's Digest. And great to see you again, Joel.
Thank you, Ivor. This is going to be a fun conversation. I'm going to help a lot of people across the ocean.
Yeah, great to be here with you. And blood pressure is what we're going to talk about, a brief conversation around the problem of hypertension, which is basically an epidemic in the West, essential or, blood pressure with no specific pathological cause that's known, but it's just you've got high blood pressure as you age. I mean, half of adults practically have it. And in the ancestral tribes around the world, they tend to not have it at all. So it's a huge problem.
I agree. I am literally, as a cardiologist, a blood pressure fanatic. We carry dozens of blood pressure cuffs. My patients go home with them because it's one of those silent parameters. And, what you can't measure, you can't fix. People come in 190 over 110 blood pressure and they feel fine. And, if they don't have some device at home to check it. Plus, number one killer in the world is hypertension, according to the Global Burden of Disease Study, 190 plus countries. About 18 million people a year worldwide die due to blood pressure causing brain infarct, brain bleed, heart attack, dissection, peripheral arterial disease, erectile dysfunction. You might as well die by the time you've had erectile dysfunction. That's just a common quality of life. But it's really a huge problem. So step one, test for it and don't rely on your doctor visits. Test for it at home. Step two, natural approaches to heal your arteries and bring your blood pressure to optimal, and you'll enhance your life quality and maybe quantity.
Yeah, and blood pressure, as well as being detrimental in itself, causing extra stress in the arteries and maybe lesions and all that kind of stuff, and causing organ damage and problems. It's also an excellent just reference to show there is something wrong in your physiology, that you have a major problem. So it's a great flag as well, a marker for an underlying thing you need to address.
Totally agree. And you're the engineer. We don't talk that much in my field of cardiology about biomechanical stresses. Your LDL oxidized cholesterol is high. It may injure your endothelium. Your blood sugar is chronically high, may injure your endothelium. But we're talking about a mechanical pounding against the aorta, against the left anterior descending artery, against your renal arteries, your femoral iliac arteries down to the legs and pelvis. And it's the mechanical forces that damage the endothelium, leading to inflammation, leading to calcification, leading to stiffening of arteries. So, a 110 over 70 is much less of a hemodynamic shearing force than a 180 over 90. So it's simple engineering, root cause analysis. And, you would know a small defect in a machine pounding away time after time is going to result in malfunction and maybe ultimately breakage of the machine. Human bodies and blood vessels are pretty similar.
Yeah, that's a very fair point indeed. And we were going to talk about how you can help with this. Obviously, diet and lifestyle always have to be mentioned first, because improving your diet, improving your exercise and your lifestyle will tend to naturally drop blood pressure. So that's really important. We were also going to talk about our mutual friend Warren of Extend Life New Zealand, VasQFlow. And I think this was one of the first products he came out with, multi-component, very well researched, the best possible ingredients from the best suppliers in the world. And it may have been the one, I think, that you first came across that introduced you to his business.
It's true. I was listening to your podcast and you interviewed Warren, and it was focusing on this recently released multi-component product all about raising nitric oxide production. And it's pretty hard to be a cardiologist and not talk to your patients every day about nitric oxide, called the miracle molecule in 1992, awarded the Nobel Prize in Medicine to 3 researchers in 1998. The fact that you can keep your arteries youthful, healthy, non-calcified, and avoid many chronic diseases, literally not just of the heart, but of the nervous system, the immune system, the respiratory system, certainly the sexual function of your body, and the endocrine function. by ensuring robust nitric oxide production in your endothelial artery lining. But how do you do that other than not smoke and get some fitness? Of course, we always base everything on a healthy lifestyle, but what else can you do to boost the miracle molecule nitric oxide? And that's what Warren really went deep on when he picked the components of VasQFlow.
Yep, that's it. And just one last word on the nitric oxide itself. It was astonishing to me when I saw the graphs of the fall off in production of nitric oxide as you age. And I mean, even if you stay apparently healthy by your measures, but certainly if you don't have all the best healthy metrics as you age, the fall off is stunning. And again, I might show it on the screen as I'm saying this. And you really got to counter that, because we all, as we age, everything gets worse. Insulin resistance tends to get worse. All of the body's functions are more challenged. So with VasQFlow, to that end, to aid and support in this important area, one of the key ingredients is red spinach extract. So maybe we'll talk briefly on that.
Yeah, absolutely. I got really excited when I looked at VasQFlow, and the first ingredient I saw was red spinach. I think it's a gram of red spinach, but I was aware for about a decade that red spinach was a big dietary source of nitrates that convert to nitric oxide. It's hard to find red spinach in your produce department. The advantage of red spinach over green spinach, besides being just this abundant dietary nitric oxide food-based source, is that some people are concerned about kidney stones with green spinach. They are very rich in oxalates, and red spinach is nearly absent oxalates. So it was something I was aware of, that the optimal nitric oxide dietary nitrate booster might be red spinach. And here, Warren of Extend Life put it in as the #1 component. By chewing, ingesting, orally taking in dietary nitrates, of which red spinach is superb choice, you boost the body's ability to make nitric oxide. As a wonderful path that everybody should utilize.
Yeah, and also the sourcing of it. Well, he's got a great research team there, so they came across the best source, and it's certainly been shown to be far superior than some alternative sources. And again, you got to get the right supplier where it's bioactive and it's the best possible quality material. And the second thing he put in was quercetin. Now, this is relatively well known out there, the importance of quercetin. So maybe we'll just touch on that.
Yeah, quercetin, and some of the world calls it quercetin, but it's a polyphenol that is rich in onions, garlic, apples, but you can concentrate it as a supplement. It's known to support that healthy lining called the endothelium by enhancing production of the miracle molecule nitric oxide. And then there's a lot of interest in it because it also seems to be an immune support supplement. There are human studies that quercetin does support a normal blood pressure in randomized studies. So perfect addition to the red spinach.
Yeah, and then one which I discovered a few years ago with a good friend of yours, Dr. Matt Budoff, who's the extraordinarily cardiologist who was involved in the early days of the CT scan of the heart, the amazing calcium scan. And I actually interviewed Matt. I was very lucky to catch him in LA back in 2017 with Dr. Jeff Gerber. And we did a great interview with him on CT scanning. But he didn't mention at that time, he is a major proponent of aged garlic and garlic in terms of helping with vascular health. And I think he has 6 or 7 papers out on that, actual RCTs. We can talk about that. But Warren has chosen the black garlic extract, harder to get, more rare, but it has a good bit of evidence to be the best possible ingredient. And Warren always goes for the best in his products.
Yeah, I agree. There's an enzyme that creates nitric oxide called NOS, nitric oxide synthase. And for reasons we don't know, garlic activates the enzymes to get more nitric oxide. When you age garlic or choose black garlic, it's more potent than just sauteing some garlic in your marinara sauce, for example. So the fact that it's in this supplement is in addition to your dietary garlic. In Japan, aged garlic, black garlic, is used as a therapy of many cardiovascular diseases. That's what our mutual friend Matt Budoff was aware of and brought back to the United States in Los Angeles, a research team. And you're right, 6 or 7 randomized human studies documenting really potent effects on blood pressure, on cholesterol, but actually on coronary artery anatomy and plaque volume. I think this is a superstar component.
Excellent. And it joins 2 other super components. And the last one we'll wrap up with is a grapeseed extract. I'm less familiar with that, but I think polyphenol and maybe an antioxidant effect.
Yes, and actually also has some data that enzyme that creates nitric oxide. And it's very important to stress. Some athletes are pounding down arginine or pounding down citrulline to get maximal nitric oxide activity. Well, it turns out if you don't have the enzyme called eNOS, endothelial nitric oxide synthase, if the enzyme isn't functioning at its maximum, you're just going to accumulate the product and it's not going to become nitric oxide. And there may be some detriment to all that. So grapeseed extract along with the quercetin can make eNOS more active. So your whole pattern in your endothelium of making more nitric oxide for cardiovascular support, sexual support, brain support, pulmonary support, bladder support, on and on, will be at its maximum. And we gotta fight that aging effect that you mentioned a few minutes ago. The fact that we produce less nitric oxide with age, and activating eNOS is one of the pathways, and natural substances do it, which is fascinating.
Yeah, absolutely. And as we mentioned in an earlier discussion we had, people need to keep in mind too that, everyone, or broadly, people respect pharmaceuticals, the amazing technology of our pharma giants to make these drugs that are unbelievably useful. Everyone accepts that, but they pretty much all come from plant world proteins and molecules in the plant world. And of course, the industry, tweaks them and, moves them around, and then they're patented and they're highly profitable and they're respected. But nutraceuticals, if properly sourced and if with the right ones, you're basically getting, the magic in the same way. It's not patented, it's not tweaked, but, it can have serious benefit because it's a similar thing in a way.
Absolutely. This synergy that was very well thought out by Extend Life's research team led by Warren Matthews. And really, we've chatted before about their other, major cardiovascular support supplement called CX8. CX8 and VasQFlow as a combination is just a 1-2 punch for augmenting your cardiovascular health, your endothelium, your nitric oxide production, your antioxidant status. So that's what I do myself. I take both those products every day and, feel wonderful and combine it with a healthy lifestyle, but it's a great supplement package.
Yeah, and same here, even though I have luckily, but you can never depend on this, never take it for granted. A few years ago, I have a 0 score. I'm 53 now. I'm probably going to check again in the next year or 2. But even with that, you want to keep it. And certainly if you've got a high score or any problems with elevated blood pressure or any other indicators, then you certainly got to do everything you can within your power, within your means, of course. There is cost involved in getting the best stuff. But it behooves us really because you only get one life. Right.
And I'll invite you in 10 years to update us because I'm 63 and I'm still in the 0 score club and a CT angiogram read by one of Matt Budoff's projects that's clean as can be. So, I don't take that lightly because that's, from a cardiovascular standpoint, one of the most optimal predictors of long-term survival. I'm going to fight to keep it 0 and keep it not calcified. And that's what I think these 2 products do so well.
Excellent. And again, just to re-emphasize that point, the variability depending on your choices and maybe some genetics. The oldest 0 I've come across is a 77-year-old. And the youngest, highest score I've hit upon is a 29-year-old in the US with a score of 600.
Just yesterday in my clinic, I had a 52-year-old who walked in, didn't know what he was coming in for, new patient, calcium score 2,400 at age 52. And interestingly, he has a pulmonary condition called sarcoidosis. And I could not find any medical literature that inflammatory lung disease causes accelerated coronary calcification. I'm pretty sure that's the case, but his whole lab panel was drawn and is pending, and he might just be a lipoprotein A inheritor. We'll see. His father had early heart disease, and sarcoid is not transmitted genetically, but lipoprotein A is. And then I have one patient about 4 years ago at age 89 said, my lifestyle has been perfect for 50 years. I want a calcium score. Honest on a Bible, 0 at 89. I've never published that, and I probably should, because that may be a world record indicating it's not inevitable that your blood vessels are going to age.
That's it, exactly. So anyway, what we were talking about there was VasQFlow. That's VasQFlow, I think. And we'll be back again chatting, Joel, next time on some other fascinating products or tips around how you maintain that healthy heart and vascular system for as long as humanly possible.
Excellent. Look forward to it.
Thank you.